Well, to make sense of all of this, we're joined now by researcher, that's Bradshaw. Thank you so much for your time, Ms. Bradshaw, and welcome to ENCA. Let's talk about perhaps the number of fatalities and deaths that you have accounted for, I understand, in South Africa, but also particularly looking at a more weekly timeline.
Hi, good day, and thanks for the invitation. We've been tracking the number of deaths that are registered on the National Population Register, and we've compared that with what would have been expected at this time of the year, because winter months does tend to have higher number of deaths. And we're putting out a weekly report on our website. And the last week that we've reported, that's the first week in July, we've seen the numbers go well above what would have been expected. It was 26% higher from all causes of death.
Now, how do you then account for those people that are not perhaps on the population register, but also in issues where there's under-registrations of deaths?
Certainly. So we've been tracking the number of deaths for many years. We actually started when the HIV epidemic broke out. And we've looked at many different data sources, the census, the deaths that are registered and reported by Stats SA, the community surveys where they ask about deaths in the household. And we've over the years, we have estimated what's missing, and it's largely in the rural areas, particularly in children, and also what's missing on the population register. So we've got a factor that's come from more or less 20 years of research that we've applied to account for what's missing.
Yeah, and I'm sure the burden of COVID-19 has, seen, of course, that impact on some of your data that you're seeing coming through.
Absolutely. When we look at the increases coming from the natural causes of death, we don't have further detail on that. But if you look at the age pattern, you can see that it's in the older people that it's really coming through in large numbers. Our report this week, I think what was very interesting was the Western Cape has shown an excess for several weeks, and it's more or less plateaued. So the larger number in this last week was actually slightly less than the previous week. It's still much higher than what it should be, but we saw a very rapid increase in Gauteng. They've shot up to being 71% higher than what would have been expected in a very short time.
Yeah, and I suppose, of course, that data coming through because Gauteng now is the epicenter of the virus. But what about other provinces? What can you tell us about the rest of, the geographical standing of South Africa, including that age group pattern?
So on the geography, Eastern Cape has been showing up as getting excess deaths. Also for a couple of weeks now, and they're continuing to increase. So unlike the Western Cape, which has in some ways plateaued, the Eastern Cape is still tracking upwards. Interestingly to me, the KwaZulu-Natal has a smallish increase overall, and eThekwini still is not yet showing something, and it's not clear whether it's just taking time for the epidemic to set in those areas. The rural provinces, Limpopo and Mpumalanga, have got lower numbers, which I think is very much in line with what the Minister of Health has been reporting on the COVID deaths.
Due to time, I'll have to leave it right there. But thank you so much, Debbie, for sharing that info. That was Debbie Bradshaw at the South African Medical Research Council. All right, those